Hi there, and welcome to the HDFS Career Podcast. My name is Dr. Lori Bulock, and I'm an assistant professor in human development and family studies at MSU. I teach several courses in the department, and one of them is HDFS 270, which introduces students to this major and to the field of family science. Quite often, students who are new to our major are not quite sure of the career options they have with a degree in human development and family studies. Some students know exactly what they want to do, and some students aren't quite sure and can sometimes feel overwhelmed. And there are other students who are in our major but plan to pursue a career in the healthcare field. These would be students who know that they want to be nurses or doctors or child life specialists, occupational therapists, and so on. The purpose of this podcast is to bring professionals on from many different areas. Each episode, I invite a professional from the community who has a background in HDFS or one that is similar to HDFS. I'm so excited you joined the podcast, and I hope today's episode will be helpful to you as you consider your career options. Hello, HDFS students and colleagues. Welcome to the HDFS Career Podcast, where we talk with professionals who have a background in HDFS or one that is similar to HDFS, and we find out about their career journey. I'm really excited for you to meet today's guest. Her name is Alyssa Jennings, and she is a physician assistant. Sorry, can't talk today. So let me tell you a little bit more about Alyssa. She is a newly graduated physician assistant, or PA, about to take her medical boards in February. In late January, she'll be moving to San Francisco, California. Sounds exciting. To pursue a career as a PA in either plastic surgery or dermatology. She graduated from MSU in 2020 with a Bachelor of Science in Human Development and Family Studies, and she used her degree in HDFS as a pre-medical PA degree. In her time at MSU, Alyssa also worked as a physical therapy aide, medical assistant, nurse assistant, and also as a dental x-ray technician for patient care hours prior to applying to PA school. So it sounds like a really well-rounded patient care hours. Her experience in the HDFS program at MSU was positive, and she felt that it provided her with a compassionate and cultural competence related edge compared to her peers. She says she is excited to share more about her experience with me on the podcast today. So, Alyssa, thank you so much for joining today to talk with me about your career experience. I know our students are going to get a lot out of it.
I'm so excited to be here, and I'm excited to share what I've done with all the HDFS students.
All right, awesome. So we'll get started with my first question. I know I read your bio, but can you explain a little bit about you and what you're doing?
Absolutely. So I'll give you the brief synopsis. So I graduated from MSU in 2020, of course, with a degree in HDFS. I grew up in Milford, Michigan, which is a small town about an hour away from MSU. I didn't really know that I wanted to go into medicine right away at MSU, but after my sophomore year, I learned a little bit about the PA profession and I just completely fell in love with it. And at that same time, I learned a little bit about the HDFS major and I was really excited and I felt that it would be a really great way to make myself more of a unique candidate for schools. And I just loved the way that they approached cultural competence, and I felt that that would add to my patient interviewing and just generally well-roundedness as a person as well. So graduated in 2020 and then took a gap year, worked with a couple different places as an MA and NA X-ray tech to get those patient care hours that are needed for PA school. And then I moved all the way to Massachusetts for my PA program. So it was an accelerated 2-year program. I just finished, I just graduated December 19th, and I take my boards on February 23rd, followed by a big move to San Francisco.
Wow, that's a lot.
Lot, yeah.
That's a lot. So I have lots of questions then about that, about many of those things. Let's start with you had mentioned that you felt like in your bio, you mentioned this, and then you just said it, that your experience in HFS helped you with cultural competence and gave you that edge uh, compared to your peers. Can you talk about that? Like in your classes, is that what you noticed?
Yeah, so a lot of our classes in HDFS does touch on cultural competence in various aspects, different types of families, different types of functioning within families and relating and talking to people. And I think a lot of medical professionals really underestimate the importance of all of those things when it comes to patient care and medicine. So, when I was interviewing for PA schools, it was really helpful to touch on some of those things that we did learn in my classes, and the schools looked at it and felt that it was a big strength for possible patient interviewing and just being a clinician that can really relate to people. I felt like every single class touched on it in some type of way. And then when I was in PA school and then on my clinical rotations, I was familiar with a lot of these different things and a lot of different cultures and different ways of communicating and ways of living and understanding the barriers to healthcare, which I believe we touched on in one of your classes actually, which was super helpful. So I already knew and was familiar with a lot of these things. And people in sort of underserved areas and the barriers that they face socioeconomically and how it relates to medicine. All of those things are so important for a healthcare provider to know. And a lot of my colleagues never had even one class about it. So I felt really prepared and really happy that I had that background. I even had one interview that I had with a patient this past clinical year. And she had found herself experiencing homelessness. And I was familiar with some of the resources that would be available to her and some of the barriers that she would be encountering, at least relevant to her healthcare. So I was able to guide that interaction in a very positive way. And at the end of the interaction, she was like, "Oh my gosh, like, who are you?" And I was like, "I'm the PA student." She's like, "I thought you were like, a social worker or something. Like, you're so good." And it felt really good to hear that, and the doctors that were supervising me noticed, and it just made me feel really proud to have this background.
That's awesome. And so I would think that that would help patients to be able to trust you better, like it establishes a rapport better.
It definitely
Yeah.
does. I think when you can look at a patient and really see what they're going through and sort of help them with the real barriers that impact their healthcare that people don't think about, it makes them feel seen, validated, and understood, and I feel that that's such an important first step to actually making an impact. It's one thing to prescribe a bunch of medicine, it's another thing to understand maybe they don't have a ride to the pharmacy, or maybe, they have no money for the copay, like, and finding resources or no housing, that's the last thing they wanna think about if they don't have housing at the moment, so finding resources that can help them, really understanding these are things that are, in my opinion, integral to actually reaching a patient and getting them to be an active part of their healthcare journey.
Absolutely. I think that speaks to not only their physical health, but it speaks to their mental health because you are able to relate with them and understand, like you said, then they feel seen and heard. And that's just such an important part of the process. Yeah, that's awesome. So glad to hear that too. And so there were some other questions I was thinking of when you were talking about some of the things like your uh what made you decide about going to Massachusetts? Was like the accelerated program?
Absolutely. So the East Coast of the United States is like a medical mecca. We have so many resources, so many giant universities with cutting edge advances in the medical system. I mean, you think Harvard's out there, UMass, Yale. So it was kind of a no-brainer that I wanted to apply out there. There's definitely amazing hospitals all over the country, don't get me wrong, but a lot of resources are focused out there, and it's just a great place to be medically trained. So that's what led me to applying to schools on the East Coast. And I was attracted to an accelerated program because I wanted to enter the workforce early so that I could start getting experience. Because I'm sure all you applicants know everybody wants experience. So the sooner I can get experience, the better. So that's what led me to MCPHS.
All right, awesome. And so in that program, was it like at first heavily course focused and then your rotation started, or did you have to balance rotations with coursework? How did that work?
Good question. So this is actually a very common question, especially with pre-PA students. So for an accelerated program, the only real difference between an accelerated and a quote unquote normal PA program is the difference between like 24 months and 27 months. So an accelerated program, typically you don't get like a month break or anything like that. You kind of go straight through. Every PA program has a year at least of clinical rotations, and that's usually performed after didactic education, which is all school. That's you're in the classroom all day, basically learning and taking exams. So for MCPHS, it's accelerated, so it's 24 months. And so from January to December of the first year, you're in didactic. There's no breaks except for like a week in between semesters usually. And you're in school from usually 9 to 5, if not more, and you take like over 75 exams. So it's very, very intense curriculum. You learn everything you need to know. PAs are trained in the medical model as generalists, so we cover everything. And then at the end, so your January of the following year, you'll start your clinical year, and you do about 9 rotations, usually in surgery, pediatrics, internal med, women's health, an elective, cardiology, emergency medicine, you name it, we do it. And then at the end of that year, December, you graduate.
Wow, that is fast, but it sounds super intense.
Yes. Yes.
Yeah. So with the coursework year, so like you said, you're in class all day long. So no real time then to have like a job or anything. How were you able to, like, through financial aid, or do you get some type of funding from the school, or?
That's also a great question. Basically, most students end up taking out loans to get them through those 2 years. You can do your grad plus loan. That's going to be where most of the money comes from, and then there's your normal. I believe it's like the federal, either unsubsidized or subsidized loan that you get. So the combination of those two loans usually finances your 2 years or 3 years in PA school. I don't know of a PA student personally that was able to hold a job throughout the curriculum successfully. It's just so intense. And the school, even at least my program, one of the first days was like, we understand that the apprehension surrounding taking loans. We feel it's worth it to mention to you that this program is a full-time job and it will be very demanding of your time. So any support you can pull from, any loans, we encourage it. So they have a very fantastic financial aid system and office within the schools that usually helps students navigate that.
Okay. All right. Good information. Good to know. And then what was that transition into that PA program like? Was it quite a bit different than undergrad? What did you experience in that transition?
Absolutely. So I would say the transition was pretty turbulent, but that's to be expected. I knew what I was getting into a little bit because, with the bachelor's in science and human development and family studies, I had to take all of the science prereqs that a normal pre-med, pre-PA student would take. So you're exposed to like the rigor of high level science courses already, and you're demonstrating your ability to handle that rigor when you're taking those classes, earning that grade, and then using that grade to apply. So I was used to the rigor of science courses. I was not used to taking 16 to 18 credits worth of those rigorous courses all at once. So they often say that like PA schools like drinking out of a fire hydrant. Like it's not the content that's hard to grasp because you have taken those prereqs and you're very smart and you're very capable if you got into PA school and they teach well. It's the amount all at once. So that can be hard to get used to, but it's kind of something you pick up very quickly because you have to. So I felt maybe it took like 2 weeks. And then I was like, okay, this is my life and this is what I'm going to do. So I feel that the upper level science courses at MSU gave me sort of a peek into what a course at NPA school might be like, but just way faster and then all at once. That makes
Right.
sense.
It does make sense. And so it sounds like you had to learn really quickly that balance of, your schoolwork and maintaining it and organizing yourself, your time. Were they all different courses throughout the day, or did you have one course all day long for several weeks and then another course? How did that work?
Good question. So typically thinking back to didactic, like on a Monday, say, we might have a total of 3 different classes, but each class would be like 2 or 3 hours long. So we would have like clinical medicine, which is case your case by case problems where you discuss diseases and the symptoms, the diagnosis and the treatment very systematically like that. And you just kind of get your hands wet and learn what each disease looks like, build a differential diagnosis. That's what that class is all about. Then we would have pharmacology, where you talk about all the medicines and the drugs that you use to treat various things and their mechanisms of actions, their side effects. And then we would have pathophysiology and then anatomy sometimes. So, it's kind of they would try to make it all one topic. So if we went through cardiology and clin med, they would try to line up pharmacology, doing cardiology medicines as well. So you're getting cardiology from several different perspectives. But that's how it would be. It'd be like 3 or 4 classes, but they're each 2 to 3 hours long.
Okay. All right. And you're right. I could see where if were able to line it up, how helpful that would be, how useful
Very,
to get like the whole picture.
very
Yeah.
helpful. I liked it when they did that for sure.
Yeah. Great information. And then so like you said, organizing your time, organizing your study time outside of class probably, and knowing when to give yourself some mini breaks, whether in the evenings or on the weekends.
I feel that that was probably one of the harder things about PA school. Like you would think that it would be the rigor or, the clinicals or something like that, but actually I felt that the hardest thing was within that transition, the first month, I would say, figuring out what study methods work most efficiently for you because everybody has something that works, but you don't have enough time to do very time consuming methods. So figuring out how you can study most efficiently, how you can fit in breaks because you need that, how you can fit in some form of social time, whether it's, going to a restaurant with friends or calling a significant other or your family. That balance can be quite challenging. And it's kind of a make or break thing because you have to pick it up. You get about a month. And if you can't pick it up, that can be quite challenging for you in your journey. The sooner you can find an efficient way and a balance, the better for your journey, I would say.
Yeah, that makes sense. So good. So knowing a few different study techniques and seeing which works best and, tweaking them from there. All right. Yeah, that makes a lot of sense. And then you go into your clinical rotation. Sounds like several within a year. So that's quite a bit. So you get what, a few weeks at each different rotation?
We do, at least at my program, we do 9 clinical rotations and you spend about 4.5 to 5 weeks at each one.
Okay. All in the same hospital or facility?
Typically, no. So I think for most PA programs, you will have clinical rotations that are close by to your school. For a lot of schools in Michigan, that's the case. So you might have like 3 at one hospital that you keep returning to, but typically they're not all in the same place. And for my school, they pretty much could send you anywhere in New England. So I had one in New Hampshire, kind of up by Canada. I had a couple in Massachusetts, couple in Michigan actually, and then I also had one in Florida. So you can,
Wow.
yeah, you travel quite a bit. And so it was fun, and also, it can be stressful at times, but I would say it was mostly fun to explore new places.
Yeah, I would think you would then get a taste for what each different system, how they do things, might be different for every place.
Absolutely. I feel that there's such a different way that like private practices operate versus major hospital systems. Even within the same hospital system, different units operate very differently, and different team dynamics. So, are the residents present? Is it mostly PAs? Is it a teaching hospital? Is it not? All these things impact sort of the work culture and your experience as a PA student or med student. So it's very helpful. And especially when you're in the job search, these clinical rotations are key to figuring out what specialty you feel drawn to. Like I said, we have general surgery rotations, internal med, cardiology. You get an elective, so a lot of people will do like NICU, dermatology, plastics, another orthopedic surgery one. So you get exposed to a lot of different types of medicine, and you're able to see where you thrive and what fuels your passion. And so by the end, when it's time to start applying to jobs, you kind of have a good idea. Do I want this specialty? Do I want primary care? Do I want private practice or a major hospital system? So I felt that that was very valuable in the job search process.
Yeah. Yeah, that sounds like it would be. And so what drew you to, like you said, possibly dermatology or plastic surgery,
Yes,
one of
yes.
those areas?
So I did my elective was in plastic surgery at UMass, and a lot of the time when people hear plastic surgery, they think of a lot of cosmetic procedures, which is part of it, don't get me wrong. But a lot of what I saw at UMass was primarily reconstructive. So you're dealing with a lot of congenital anomalies that they might be correcting, a lot of post breast cancer treatment in women. Gender affirming care was very popular as well. So a lot of very rewarding cases of people that had very long journeys getting to us, and then they finally came, and we were able to give them back something that they feel that they may have lost or was missing. So it's more than just Botox. There's quite a bit, there is a good part in that, and it does help people, and it makes them feel better in some type of way. But there is reconstructive care and affirming care and so many aspects to it that I love. And then with dermatology, a lot of underserved communities have a really hard time getting dermatology care. It's kind of a long waiting list to get into offices. They're not often placed in underserved areas. And then once they get in, there's all these barriers to getting the kind of care that they need. They maybe can't come as frequently. So I wanted to be part of the solution for that. And dermatology and plastic surgery kind of work hand in hand. So I'm very interested in the skin and getting people to feel empowered in their health care. I feel that the skin is one of the coolest organs of the body as well. I'm kind of a huge nerd when it comes to that. I could go on and on about that, but I'll spare you. Um, so I'm really interested in the fields for those reasons, and I just love working with people. I am a people person, as most HDFS people are, and I loved surgery, don't get me wrong, like in the OR, but I'd be sad that the patient was asleep the whole time. I could never talk to them. So I kind of like the clinic, and I just need a job where I'm talking to people and helping them overcome and feel empowered, which I think is such a big part of HDFS. So it definitely shows up in my specialty selection for sure.
Yeah, that's awesome. I do want to ask one question about the rotations though, again.
Yeah,
Did you have to find those different places, or were they suggested, or a
it's a good question.
combination?
Great
Yeah.
question. So that's actually something that distinguishes PAs from nurse practitioners. We have a very similar journey, and we're a similar job, but typically in NP school, they have to find their own rotations, and then they often have to work during their rotations. So for PAs, it's our full-time job to be doing these rotations, and the school will set them up for you. So you may or may not have to find housing. Like some schools will give you a stipend for it, and some won't. It just depends on the program. But all the schools find the rotations for you, so that's super helpful.
Okay. Yeah, that it would be helpful.
Yeah.
Because I could see where that could be overwhelming to add that on top of everything you're trying to keep up with. Yeah.
Yes, I was very happy that they did that, and you pretty much get rotations around the area that you're in, at least a few of them, even if your school wants you to travel. So if you are attracted to the East Coast, or if you want to get a job on the East Coast or the West Coast or wherever, it's wise to find a school near where you want to work, because you get a lot of job opportunities in your clinical rotations, or at least a lot of networking. So it's helpful in that way.
Yeah, I could see where that would be. That's awesome. All right. And so now you've graduated, you've done all that. And so that's exciting. Just in December, you graduated.
Yes, I'm very excited. I still have my
Yeah.
board, but it's a very different experience being out of school versus in, I will say that.
Yeah. I bet. Did you like not know what to do with yourself for the
Yeah, I
first week?
remember there's always, me and my colleague were talking about this. There's always this post, like every time we were on a break or something for that week break in between semesters, you get this feeling of I need to be doing something, like, because you're just in this robot mode the entire time, and it's like there's always something you could be doing. So to have like nothing, it's almost unsettling. So I would find stuff for myself to do, or I have this little suture pad and I would like practice suturing or something just to give my brain something to do. So I still have studying right now. Like there's tons of studying I have to do for these boards, and like I'm trying to get back into working out and like self-care stuff. So I'm not having it as bad, but there's still this like, I'm not going back to school. There's no more lectures. I don't have to report to a site for clinical rotation. Like it's just a weird, surreal feeling, but a very exciting one. Like I'm just so much closer to what I really want to do.
Yeah. That's awesome. Um, and exciting, like you said, and but also kind of, what do I do now? What do I do with myself?
Yeah.
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 I
It
can
feels
relate.
out of it. It's a very weird feeling. I don't even know if there's a word to describe it. But it's normal. So if there is a student out there that experiences that, it's normal and it's temporary. But it's interesting. I mean, I think that there's probably the same feeling in other aspects of life. Like you get into something and you engulf it, it becomes your personality almost for a couple years, and then it stops, and then you have this sort of life transition. I'm sure a lot of people could relate to that. It feels just like that.
Yeah. Yeah, definitely. I can see that. Um, so then studying for your boards, are there like practice tests and some material that you're using? What is your method for preparing?
Also a good question. So, in didactic, right, we had PowerPoints and like learning materials similar to how undergrad you would study. You would just, use those lessons and make it into a study format that suits you. So we would do that in didactic. In clinical year, there isn't lectures. So oftentimes the student has to figure out what resources will work best for them on their own. So that can be challenging for some people, but there's often online resources like study guides and um podcasts, tons of podcasts, YouTube videos if you're more visual. There's a lot of ways that you can pick up the material, and then the NCCPA, which is the board that certifies us, they release a blueprint or like a topic list of what will be on the exam, and then you study those topics kind of on your own independently. So with your board exam, it's similar to clinical year in that. So there's not like a study guide per se. There's quite a few practice exams out there, but our board exam is so long that I don't know how you would get through that many practice exams. And there's so many topics that you have to know such minute details about. I would say there's valuable resources out there that you can use to kind of study as you go. It usually takes like 4 to 8 weeks on average to study for our boards, and like 4 to 8 hours a day of studying. So it's quite intense even after. Some resources that I use to study for my boards would be Rosh Review. That's one of my favorite ones. They do practice questions and they have a whole pants, which is our board exam, QBank. There's Smarty Pants, which has an 8-week study schedule. I use that. There's other programs out there, but those are one of like probably the two of the most popular ones. I would say Rosh is like the holy grail of study material though. So you pretty much do like I'll do like 67 Rosh questions a day, and then I'll do maybe like an maybe 4 hours of topic-based studying on Smarty Pants per day, and then write it all down in a notebook and review it as I go and cross my fingers.
Yeah. But it
Yeah.
sounds like you have a pretty good, what do I want to say, regimented study program for yourself. So that's a great idea. Um, one question I had, okay, so you mentioned like PowerPoints from your courses and things like that. So you saved a lot of your course material
Mhm,
then,
mhm.
books also, and
They have books that you can purchase, but I think the only books that we really used, at least in my program, were for anatomy and then the pharmacology book, that they actually did assignments based off of. Most of the teachers will pull what you need to learn into the PowerPoints. So they might have recommended books, but that doesn't mean you actually have to get them. The PowerPoints or resources that they might point you to in class would be more important to do. And then usually, you know, you I had I know most PA programs require like a Mac or some sort of laptop and then an iPad. So you'll take notes on like something like Notability or OneNote where you can just directly write on the PowerPoints. So that's another helpful tool as well for studying.
that's great. So keeping all of the PowerPoints and maybe assignments or, notes and definitely things like that. So keeping those and keeping them organized probably so you can refer back to them to study.
Exactly.
All
Exactly.
right. Sounds good. And then in addition to all of the resources that you mentioned. So you mentioned a lot of great resources.
Yes, I recommend those. I always recommend for the pre-PA students. I've spoken at some of the pre-PA meetings at MSU, and I usually recommend for applicants the Applicant's Manual of Physician Assistant Studies by Mark Volpe. It can be found on Amazon. It has every PA program in the country in alphabetical order with all of their contact information, statistics, prereqs all in one place. So if you're interested in pre-PA, it's a great place to start. I remember I used to go to the MSU library with my Starbucks, and then I would take a sticky note pad and I would just sticky note all the schools that I qualified for and go from there and email them just using that book. So it's my favorite resource. It's like the only thing I would say is worth it to spend money on, except for like a mock interview. I would also say that's worth it. Um, I would say that's like the best thing for an applicant to have, and I hope everybody has it because it's awesome.
That's a great tip. That's a great tip. Hopefully students will catch that and do that too. So yeah, that's great. And you were always such a thorough student too. So I could see why you would I'm not surprised that you were thinking ahead and looking and what do I need and what do I prepare myself for?
Oh yes. Oh yes, always.
Yeah, that's great. So then looking towards the board exam, so sounds like is a sit down exam. Is there like a multiple choice or written? Do you have to have any kind of oral part of it, like answering questions or anything like that?
Yeah, so similar to how the GRE is conducted, it is one of those types of exams where you go to a testing center, um, and it is a multiple choice 300 question exam. You get a minute per question, so it is timed. Um, and it covers everything you learned in PA school. And that's the format of it. I think it's about 5 or 6 hours long. Well, you get a minute per question, so, 300 minutes, however many hours that is. I'm not a math person, but
Yeah.
that's how long it is. I think you get breaks after every 60 questions that are like 5-minute breaks. Um, and that's it. Then you take the exam, you hear back if you passed or not in 2 weeks, and then if you pass, that's kinda like the last ingredient you need to get your license, and then when you have your license, you can work. So everybody is eager to take it and pass it as soon as possible.
Absolutely. Okay. Great information, great detail. So hopefully this will be helpful for students
Yes.
to plan ahead. Okay. So then you take your test, like you said, you hear in 2 weeks. What drew you to going to San Francisco?
It's a great question. I grew up in the Midwest. I grew up in Michigan. I went to MSU. I love MSU and I love Michigan. But I was looking for sort of a different experience with my medical training. So I was attracted to the East Coast. And then I felt like I got a good dose of the East Coast, and why not try the West Coast out? And what helped was my partner did get a job out there. So that kind of solidified my idea to go out there. I feel as though California is kind of the birthplace and just a great location for plastic surgery and dermatology. A lot of the new developments happen out there. It's just a great place to be if you wanna get some really great training in those fields on top of the East Coast. It's also a great place, but, you know, um, I just thought it'd be really cool to be raised in the Midwest, medically trained in the East Coast, and then trained again on the West Coast. Like, why not, you know? I thought it'd be
Yeah.
cool. I haven't been there, but I've heard everybody says it's really cool and really pretty, so I'm excited.
Yeah, that is exciting. That's a cool way to look at it too. Just, a variety of settings. And as you mentioned, if your partner has a job there, that does make the transition or the move there much easier.
So much easier. So much easier. I am so grateful that he has something there. It helps me to kind of relax and study for my boards a little bit while I'm there and not have to worry about all the worries that are associated with moving. So I'm excited and to get a new experience and to meet new people and new ways of life and new perspectives. I think it all will contribute to a really great start to my career as a PA.
It sounds like it. Sounds like it will. Do you have contacts out there already in terms of job possibilities?
Oh, jobs. I thought you meant like people, like
Well,
networking or something.
there's that too.
Yeah.
Yeah.
I don't think so. I mean, I might. I know that there's some people from MSU actually that moved out there that I used to talk to. So I might, reintroduce myself and see if they want to hang out and talk again. So that'll be exciting. The MSU community is so big and throughout the country. Like you don't even realize you'll go somewhere and there'll be a Spartan there. So it's really exciting. And obviously the Spartan alumni, we're all so full of pride and we love each other already. So I'm really excited to see some Spartans out in California, and I know that they'll be great. So as far as networking goes, basically my MSU community, and that's probably the only people I know are going to be there. As far as jobs, I am interviewing at two different locations. One is a plastic surgery place in San Francisco, and then another one is a dermatology place in Stockton, which is like an hour inland. Um, so we'll see. And I'm hopeful that I find a role that has a really warm and welcoming team that loves to teach and train up new grads. That's probably my highest priority at this point is a good positive teaching environment.
Yeah, that's great. And it's great that you know that that's what you want to look for also. That's great. Did you get some advice from others, like your professors and other student colleagues when you were in your PA program
I would
about this?
say the I always recommend for students and of course myself to go to the class above you and try to find one or two mentors because it's super helpful. I mean, just for didactic exams, even something as small as that, like asking how an exam or a teacher or a class was, to clinical sites, like if they had the same site to know what to expect. And then finally, in the job search process, what do you wish you knew? What is important to look for in a job and in a contract? Because many of us haven't ever signed like a real contract before. That can be quite a daunting task. So I recommend getting mentors. I definitely used mentors throughout my experience, and I had the support of them in the job search and throughout the entire PA school experience. Professors are very helpful too. Obviously, they're quite busy, but they do their best to try to help you in any way that they can. But a lot of the times, it's really the mentors or the students ahead of you that just did it. So it's all fresh and they're able to give you sort of real-time advice on some of these details that you wouldn't even think of.
I'm really glad you talked about that. That's so important, looking for mentors, like you mentioned. It sounds like just kind of helps put you at ease and helps you prepare of knowing what to look for and what to plan for.
Yes, I think it's so important. I mean, just not even just for success in a program, but for networking and support. I think that having an adequate support system in PA school or in any rigorous field that is in caring for people, you need somebody there to support you, and everyone's going to need help at some point. So it's really important to establish relationships with your colleagues and with your mentors and with a trusted advisor and your family and whatnot. I think that's very crucial to your success just as much as a good solid study plan is.
Yeah, that's awesome. Great information for my students. Looking here at my questions again, make sure I didn't miss
Sure.
anything. Um, what recommendations, think you probably just covered this, but what recommendations do you have for students as they prepare for PA school or for applying for PA school?
Yes. I know that if there are any pre-PA students out there, it is very hard to get into PA school. It's a very competitive field, and I feel that it gets more competitive every year. So I understand and I validate how challenging this season of your life is, and getting those patient contact hours and studying, and the applications are expensive. So I know how much it is. And I just want to sort of encourage you to keep going and to really understand the positive impact that you are going to make in the field, and what you bring and everything that you bring with you and how it will bring value. If I had advice in a practical sense, I would advise that book. Um, every PA program has different requirements, and I'm sure that pre-PA students are familiar with that. So it can be quite time consuming having to look up each individual school on your own and sort of search their website for all of their requirements. And it's not always in one place. So I often recommend that Applicant's Manual by Mark Volp on Amazon um, for students, because it's all in one place. And then you can just sticky note the areas or the schools that you qualify for, and you can email them from there. Like it's literally the Bible of applications, in my opinion. And then on top of that, I would recommend diverse patient care experiences. I've seen quite a few applicants that have a lot of hours in one job, which is a strategy, and I've seen it work, but I've seen a lot more success when students have experience from 2 or 3 jobs. So it is important to have over 1,000 patient contact hours. Everybody knows that. But it is a very big advantage to have diverse experience from multiple jobs. And there's some jobs that are sort of like gold standard jobs that schools really love to see, and that would be like an EMT. They love that experience. So if you're interested in that, it's a great field to go in. Various medical assistants are great experience. They even love like nursing or something like that. And yeah, I would say diverse experience, that book, patience and casting your net pretty wide. It is very competitive. Try to keep that GPA up. They're really looking at your science prereq courses and just making sure that you can handle the rigor that's going to be in PA school. So a lot of schools require that you have mostly A's and B's. I think you can usually have one C and get away with it. But that's how strict it is. So just keep, an eye out on those grades, and do your best, and shadow. So make a lot of networking, events and experiences if you can. Try to get in with a PA because shadowing will be required and they're very helpful. And you'll need letters of recommendation as well. So try to form relationships with advisors or professors that you trust. And that's about all you can do. And I just wish you patience and the best of luck in that journey, and just keep at it. You will get it.
I appreciate that. Um, the gap year that you took, do you find that a lot of PA applicants do that in order to get the 1,000 hours patient contact?
Yes, it's so challenging to be full-time in school and get over 1,000 hours of work experience. I myself am a huge proponent of the gap year if you can do it. I had 3 roommates in PA school. One did not do a gap year, and then the other did, and I did as well. And basically, the experiences of all of us, I felt that the gap year gave me some rest time to sort of get back to baseline and then prepare myself for the rigor that was to come. And more importantly, get a different patient contact job and accumulate those hours. And I think I hit over 1,000 gap year. So it was very helpful for me. The roommate that didn't take a gap year had already started working patient contact hours. I want to say it was either during her freshman year of college or just before it. So she already had enough. So she felt she didn't need as much of a rest. And so she supports that. And I think if that's where you're at and you feel like you're ready, I don't see why not. The challenge with not taking a gap year that I think is very important to let students know about ahead of time, you may have to go on interviews for PA school during the fall of your senior year if you choose not to take a gap year. So that can be costly if you're applying and casting your net wide because you have to fly and get hotels. You might miss out on those fun senior year things. It's certainly okay if you choose to do so, but just know that that's kind of where the timeline lines up. So that would be probably the biggest factor, in my opinion, is if you're okay with doing all of that during your senior year of college. And if you would like to not do that, then I would recommend the gap year.
Okay. And it sounds like a gap year definitely doesn't hurt at all. Sounds like it
No.
benefited you greatly. And so
Yes.
it's not like the PA schools look down on that or look at it any differently.
Not at all. Not at all.
All right.
It's you're treated the exact same.
All right. Really good practical information to know for students. Good deal. Okay. Let's see. I'm looking at my questions here. I think we've covered just about everything. But so yeah, so my last question, because I think we've covered everything, because you've given such great, really thorough information that I think is going to be really useful to students. So my last question is it okay if students contact you if they have questions?
Of course. I am always happy to answer questions. Um, I I love to help students. I love to and you can email me at any time because I am always on my phone. So please don't hesitate. I'll help you in any way that I can. Even if you think a question's kind of silly, there is no silly questions to me. I'm very open and I will be honest in my experience.
That's great. That's really helpful too. Well, it has been so much fun catching up with you and having you on the podcast today. Thank you for giving me your time, giving my students your time to share your experiences.
Of course, I'm so excited. I love my MSU community. I bleed green all the way on the East Coast and again on the West Coast. I MSU is always going to be my home and I will always help a Spartan no matter what. So, thank you for having me and I had such a positive experience in your classes and with HDFS. So, I hope your students see value and are finding this helpful if they're interested in healthcare.
That's awesome. Thank you so much.
Of course, of course.
Thank you for joining today's episode of the HDFS Career Podcast. I really hope you enjoyed meeting Alyssa Jennings and learning about her career so far. She just finished PA school, going to take the board, and then her career journey will take off from there. But she gave such valuable information about the PA program, the transition to it, how she's studying for the boards. Just really great information that I think will be helpful for you if you are considering a career as a physician assistant or anywhere in the healthcare field. The information that she provided, I think, would be applicable towards many of those careers. As we discussed at the end of the interview, you can find Alyssa's contact information in the episode description. She would be really happy to talk with you and answer any questions that you may have. She talked at length about this in the interview. So please reach out to her if you are thinking of pursuing a career as a physician assistant. Please join me again soon for other interviews with other professionals to learn about the many options that you have available to you as you are pursuing a degree in HDFS. Enjoy the rest of your day.